Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about assessment of high-risk pregnancy. Let's get started. Every pregnancy is special and needs proper care and attention. But sometimes, a mother or her baby may have certain health conditions or complications that make the pregnancy more risky than usual. When this happens, we call it a high-risk pregnancy. A high-risk pregnancy means that there is a greater chance of problems or challenges for the mother, the baby, or sometimes both. Before the baby is born, during the delivery, or even after birth. In simple words, it's a pregnancy that needs extra care, medical supervision, and regular checkups to make sure both mother and baby stay healthy and safe. So what exactly is a high-risk pregnancy? A high-risk pregnancy is when there's a greater chance of complications that could affect the mother, the baby, or both. This can happen for a few different reasons. First, the mother might have some health problems, like high blood pressure, diabetes, heart disease, or other medical conditions. Second, there might have been problems in previous pregnancies, such as a miscarriage, preterm delivery, or complications during childbirth. And third, there could be risks related to the baby. For example, if the mother is carrying twins or triplets, or if the baby has growth or development problems. In short, a high-risk pregnancy means that extra care and close monitoring are needed to keep both mother and baby safe and healthy. Every pregnancy is different, and some become high risk because of certain factors related to the mother. Let's look at the common causes or risk factors that make a pregnancy high risk. Mother's age. If the mother is younger than 18 years or older than 35 years, there is a higher chance of complications. Younger mothers may not be fully developed physically, while older mothers are more likely to have health problems like high blood pressure or diabetes. Health problems, conditions such as high blood pressure, diabetes, anemia, or thyroid disease can affect both the mother and the baby's health during pregnancy. Past pregnancy problems. Women who have had miscarriages, stillbirths, or cesarean deliveries before may have a greater risk of complications in the next pregnancy. Multiple pregnancies, carrying twins or triplets puts extra strain on the mother's body and increases the chance of early delivery or other problems. Lifestyle factors. Habits like smoking, drinking alcohol, poor nutrition, or high stress can harm both the mother and the baby. Infections. Certain infections such as HIV, hepatitis B, or torch infections can cause complications and affect the baby's development. In short, these mother-related factors can increase the chances of a high-risk pregnancy. That's why regular checkups, eating healthy food, and maintaining a positive lifestyle are very important for a safe pregnancy. Some risk factors are related to the baby's health and development. These are called baby-related factors. Poor growth of the baby. Sometimes the baby does not grow well inside the womb. This is known as intrauterine growth restriction, or IUGR. It can happen due to problems with the placenta, poor nutrition, or other medical conditions. Multiple fetuses. When the mother is carrying twins or triplets, it puts extra stress on her body and increases the chance of early delivery or low birth weight. Birth defects. Some babies may develop structural or genetic problems while growing in the womb. These birth defects can make the pregnancy more complicated. Too little or too much amniotic fluid. The fluid that surrounds and protects the baby inside the womb is called amniotic fluid. If there is too little or too much of it, it can cause problems during pregnancy or delivery. Abnormal fetal position. Normally, the baby should be head down before delivery. But sometimes, the baby may be in a breech or sideways position, which can make delivery more difficult. In short, These baby-related factors can increase the risk during pregnancy and need close monitoring by healthcare professionals to ensure both mother and baby stay safe. Assessment of a high-risk pregnancy means checking and identifying if the mother has any danger signs or risk factors that could cause problems during pregnancy, delivery, or after birth. The first step in assessment is history taking. This means asking the mother important questions to understand her health and background. Personal details. Ask about the mother's age, occupation, daily habits, and nutrition. These details help identify risks related to lifestyle and diet. Past pregnancies. Find out about her previous pregnancies, how they ended, and whether she had any complications such as miscarriage, stillbirth, or cesarean delivery. Medical history. Ask if the mother has any long-term health problems like diabetes, high blood pressure, or heart disease. These conditions can affect pregnancy. Family history. Some diseases run in families. It's important to know if there are any genetic or inherited conditions. Psychological and social background. Ask about the mother's emotional health, level of stress, family support, and whether she faces any form of violence or abuse at home. These factors can also affect her health and the baby's well-being. In short, taking a good and complete history helps the healthcare provider identify risks early and plan proper care for both mother and baby. Physical examination is an important part of assessing a high-risk pregnancy. It is done during every antenatal visit to check the mother's overall health and to identify any warning signs early. The first step is the general examination. Measure height, weight, and body mass index, or BMI. This helps to know if the mother's weight is within a healthy range for her stage of pregnancy. Both underweight and overweight mothers can have complications. Check vital signs: blood pressure, pulse, respiration, and temperature. Blood pressure is especially important, as high blood pressure can be a sign of pregnancy-induced hypertension or preeclampsia. Look for signs such as pallor, edema, or jaundice. Pallor means paleness of the skin, which may indicate anemia. Edema means swelling, especially in the legs, which could be due to high blood pressure or kidney problems. Jaundice, or yellowing of the eyes and skin, can be a sign of liver disease. Regular physical examination helps detect these problems early, so that proper treatment and care can be given on time, keeping both mother and baby safe. Next comes the obstetric examination, which focuses on the mother's abdomen and the baby inside the womb. This examination helps to check the baby's growth, position, and overall condition. Inspection. The healthcare provider looks at the size and shape of the mother's abdomen. This helps to estimate how far along the pregnancy is and whether the baby's growth looks normal. Palpation. This means gently feeling the mother's abdomen with the hands to check 3 things: the fundal height, which helps to assess the baby's growth; the lie of the fetus, meaning how the baby is positioned inside the womb, whether it is lying across, lengthwise, or diagonally; the presentation, which tells which part of the baby is coming first. Usually it should be the head. Auscultation. This means listening to the baby's heartbeat, using a stethoscope or Doppler device. The normal fetal heart rate is between 110 to 160 beats per minute. Any variation from this range may indicate a problem that needs attention. After the obstetric examination, a systemic examination is also done. This includes checking the heart, lungs, and abdomen of the mother to find out if there are any abnormalities or health issues that could affect the pregnancy. All these assessments help in ensuring that both the mother and the baby are healthy and progressing well throughout the pregnancy. Next comes the obstetric examination, which focuses on the mother's abdomen and the baby inside the womb. This examination helps to check the baby's growth, position, and overall condition. Inspection. The healthcare provider looks at the size and shape of the mother's abdomen. This helps to estimate how far along the pregnancy is and whether the baby's growth looks normal. Palpation. This means gently feeling the mother's abdomen with the hands to check three things. The fundal height, which helps to assess the baby's growth. The lie of the fetus, meaning how the baby is positioned inside the womb, whether it is lying across, lengthwise, or diagonally. The presentation, which tells which part of the baby is coming first. Usually, it should be the head. Auscultation. This means listening to the baby's heartbeat using a fetoscope or Doppler device. The normal fetal heart rate is between 110 to 160 beats per minute. Any variation from this range may indicate a problem that needs attention. After the obstetric examination, a systemic examination is also done. This includes checking the heart, lungs, and abdomen of the mother to find out if there are any abnormalities or health issues that could affect the pregnancy. All these assessments help in ensuring that both the mother and the baby are healthy and progressing well throughout the pregnancy. Laboratory investigations are an important part of caring for a high-risk pregnancy. These tests help doctors and nurses identify any hidden problems in the mother or the baby early, so that proper care can be given on time. Let's look at some common investigations done during pregnancy. Hemoglobin test. This checks for anemia. Low hemoglobin means the mother doesn't have enough healthy red blood cells, which can cause tiredness and affect the baby's growth. Blood grouping and Rh typing. This test finds out the mother's blood group and Rh factor. If the mother is Rh negative and the baby is Rh positive, there can be complications unless special care is given. Urine tests. The urine is tested for sugar, protein, and signs of infection. Sugar in the urine may suggest diabetes, and protein may indicate kidney problems or preeclampsia. Blood sugar test. This helps to detect diabetes during pregnancy, which can affect both the mother and the baby if not controlled. VDRL, HIV, and HBsAg tests. These are screening tests for infections like syphilis, HIV, and hepatitis B. Detecting these early helps prevent the infection from spreading to the baby. Ultrasound scan. This is a very useful test to check the baby's growth, position, and overall development inside the womb. It also helps to find out if there are multiple babies or any abnormalities. All these investigations together give a clear picture of the mother's health and help ensure a safe pregnancy and delivery. Sometimes in a high-risk pregnancy, the doctor may recommend some special tests to check the baby's condition more closely. These tests help in finding out how well the baby is growing and whether the baby is getting enough oxygen and nutrients. Non-stress test, NST. This test records the baby's heartbeat while the baby is moving inside the womb. A healthy baby's heart rate usually increases when it moves. The NST helps doctors know if the baby is getting enough oxygen and is safe inside the uterus. Amniocentesis. In this test, a small amount of amniotic fluid, the fluid around the baby, is taken using a fine needle. It is done under ultrasound guidance to check for genetic problems or birth defects in the baby. It also helps find out the baby's lung maturity in late pregnancy, if an early delivery is planned. Doppler study. This test uses sound waves to measure the blood flow between the mother and the baby through the placenta and umbilical cord. It helps to find out if the baby is getting enough oxygen and nutrients for proper growth. Now let's talk about some common high-risk conditions during pregnancy and what nurses should focus on while caring for these mothers. Hypertension or preeclampsia. In this condition, the mother has high blood pressure during pregnancy. The nurse should regularly check the blood pressure, look for swelling of the feet or face, and ask if the mother has headaches or blurred vision. Early detection helps prevent serious complications. Diabetes in pregnancy. Some mothers develop high blood sugar during pregnancy. The nurse should monitor the mother's blood sugar levels Encourage her to follow a proper diet plan, and ensure she takes medicines or insulin as advised by the doctor. Anemia. Anemia means low levels of hemoglobin in the blood. The nurse should give iron and folic acid supplements as prescribed, and provide advice on eating iron-rich foods like green leafy vegetables, dates, and meat. Ellie. Multiple pregnancy. When the mother is carrying twins or triplets, she needs extra rest and more frequent checkups. The nurse should monitor her for signs of preterm labor and ensure she gets proper nutrition and support. Ellie. LP is incompatibility. This happens when the mother's blood group is Rh negative and the baby's is Rh positive. In such cases, the nurse should make sure the mother receives an anti-D injection after delivery or after any event that may cause blood mixing, as advised by the doctor. Ellie. Antepartum hemorrhage. This means bleeding from the vagina during pregnancy, before delivery. The nurse should observe the amount of bleeding, keep the mother calm, and make sure she gets immediate medical care. Ellie. Each of these conditions needs special attention, regular monitoring, and good communication between the healthcare team, the mother, and her family to ensure a safe pregnancy and delivery. End. Now let's look at the nursing responsibilities in caring for mothers with a high-risk pregnancy. Nurses play a very important role in keeping both the mother and the baby safe. Early identification of risk factors. During antenatal visits, the nurse should carefully assess the mother to find out if there are any health problems or risk factors that could lead to complications later. Early detection helps in giving proper care at the right time. Regular monitoring of mother and fetus. The nurse should check the mother's blood pressure, weight, and general health, and also monitor the baby's growth and heartbeat regularly. Provide health education. The nurse should teach the mother about the importance of good nutrition, adequate rest, and taking medicines as prescribed. She should also explain the warning signs to watch for, such as bleeding, severe headache, blurred vision, or no fetal movement, and advise the mother to report these immediately. Regular antenatal checkups should be encouraged to ensure the pregnancy is progressing normally. Emotional support. A high-risk pregnancy can cause anxiety and fear. The nurse should reassure and counsel the mother, listen to her concerns, and help her feel supported and confident. Referral to higher centers. If any complication arises or if specialized care is needed, the nurse should make sure the mother is referred promptly to a higher medical center for further management. In short, the nurse's role is to observe carefully, educate the mother, provide comfort, and act quickly when needed, ensuring the best possible outcome for both mother and baby. Finally, let's talk about some important health education points for mothers with a high-risk pregnancy. These tips help in keeping both the mother and the baby safe and healthy. Attend all antenatal checkups regularly. Regular visits to the healthcare center help in early detection of any problem and ensure that both mother and baby are developing well. Eat a balanced diet rich in iron, protein, and calcium. Good nutrition helps prevent anemia, supports the baby's growth, and keeps the mother strong throughout pregnancy. Avoid smoking, alcohol, and drugs. These can harm the baby's growth and lead to serious complications, so they should be completely avoided during pregnancy. Report danger signs immediately. The mother should seek medical help right away if she experiences any of the following: vaginal bleeding, severe headache or blurred vision, swelling of the face or hands, reduced or no fetal movement. Prepare early for a safe delivery. It is important to plan in advance for delivery and arrange emergency transport if needed, especially in case of complications. Period alling. In short, regular checkups, healthy eating, avoiding harmful habits, and being aware of warning signs can make a big difference in ensuring a safe pregnancy and a healthy baby. Let's quickly summarize what we've learned. A high-risk pregnancy is one where there are increased chances of complications for the mother, the baby, or both. With proper assessment, regular monitoring, and good nursing care, many of these risks can be reduced or even prevented. Nurses play a vital role in identifying problems early, providing the right care, and offering emotional support to ensure the safety and well-being of both the mother and the baby. In short, timely care, awareness, and teamwork between the healthcare provider and the mother make every pregnancy safer. That brings us to the end of today's session on assessment of high-risk pregnancy. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.